Hi folks, John Adamson, the Rehab and Documentation Guru, doing a follow-up video to the video I just did answering Laura's questions about a patient with diabetes and PAD who wants to get a prosthesis, and he's legally blind and he's got no sensation whatsoever from the buttocks down. And I wanted to just follow up because there's some other things you can look at to determine how healthy this limb is. So besides the brachial ankle index, which I mentioned in the other video, there's some inspection things that I generally do. I mentioned looking at the foot and seeing if there was a collapsed medial arch and kind of a rocker shape to the foot, which we would call Charcot foot deformity. So I look for that. The other thing I would look at was whether or not the patient had any hair on his legs. Now, a lot of patients as they get older don't have hair on their legs anyway, but die off of the hair follicles is one indication that they have some PAD. Another indication you look for is how warm or cool the tissue is. And obviously, if you've got a lack of blood flow to an area, it's going to tend to be more pale, and it might even become cyanotic. But paleness is probably an indication that they're not getting good blood flow. The other thing you look for is what's called rubor of dependency. Now, what is rubor dependency? Well, when the tissues are ischemic, one of the things that can happen to them is when you make them dependent, so you put the limb lower than the heart, they can develop a rubor, a very dark reddish color. Much more red than the tissue above them. And so if you make this patient's limb dependent, hanging down, you may note that the toes and the foot are much deeper red or pink than the more proximal tissue. And that's a sign that the tissue is kind of starving for oxygen. So that would be another thing I would look at. The other thing, of course, is thickening of the nails. And so thick nails become brittle, and they also can be subject to infection. And so you want to look at whether the nails are thickened. That is a sign of chronic lack of blood flow to the area. If it's a more recent thing, or I should say there's another type of nail change that can occur, though I've not seen it in this particular case. You see it more in COPDers, is clubbing of the nails, which you can even get some clubbing in the toenails, but I've seen it more in the fingernails and just with COPD. So anyway, you look for that. So do a lot of inspection. Another thing you want to look at is whether they have peripheral venous insufficiency. And so you look for what's called hemosiderin staining. Hemosiderin, hemo, meaning blood, sidrin, the part of that root has to do with iron. It's iron deposits in the skin. And especially in lighter colored individuals, Caucasian, or somebody that has a light brown skin, it's easy to see. It's harder to see in people of African descent. But hemosiderin will cause a rust or brownish color to the skin, and it's a lack of chronic venous insufficiency. And that can be problematic too. And so you look for those kinds of things and changes. What else can you see? Well, toe changes. Now, in somebody that has diabetes and peripheral neuropathy, we look for things that indicate intrinsic muscle loss. So, for example, hammer toe deformity. And so I would look for that as a possible clinical indication of insufficient blood flow and peripheral neuropathy. The other thing you might look for is for Hallux valgus deformity. So Hallux valgus is an outward pointing of the great toe, and people usually call it bunion. And so anyway, we look for that, and that's generally a sign that the great toe, the big toe, is getting a lot of stress applied to it laterally. It's being pushed laterally. Why? Because they're getting a collapse of the medial foot arch. So it's all mechanical. And so that rolling medially, because of a lack of arch support, does put a pressure outwardly on the great toe. And I know there can be other factors involved, but that does tend to lead towards Hallux valgus. So those would be observational things you can do besides the brachial ankle index that really tell you how healthy that limb may be. Anyway, John Adamson, the Rehab and Documentation Guru, part 2 to the case study. Take care and God bless.